ACH weekly webinar. My name is Lindsay, and this webinar will focus on value-based payments. Before we get started, we'd like to take a moment for a land acknowledgement. We begin by acknowledging, with humility, that the land where we are today is the territory of the people of the Salish Sea. Their presence is imbued in the waterways, shorelines, valleys, and mountains of the traditional homelands of the Coast Salish people, since time immemorial. I'd like to cover a couple of housekeeping items before we start. Please note that your lines will remain muted for the duration of the webinar. We encourage your participation. You can send your questions in at any time using the chat box in the Zoom window. We're monitoring those questions and we'll try to respond to them before the end of the session. Any questions not covered due to time will be addressed in a frequently asked questions page uploaded to the partner portal along with this recording. For the first part of this week's webinar on value-based payments, we'll show a brief video providing an overview of value-based payments. And for the second part of this webinar, Nicole and Amanda will present an update on the value-based payment survey and how it might affect you as providers in the North Sound region.
What if, instead of paying for health services, we paid for healthier people? Value-based purchasing is changing the way providers care for patients by purchasing healthcare based on value and rewarding providers who work together with their communities to improve patients' mind and body. In a traditional payment structure, providers bill for services, regardless of patient outcome. With value-based purchasing, the state pays for healthier patients, not volume of services. Providers will be rewarded on quality of care and patient experience. This shift to patient-centered, evidence-based, whole-person care leads to better care, healthier communities, and lower costs. Washington is at the forefront of a national movement toward value-based purchasing. The Healthcare Authority is using its purchasing power to lead by example and to accelerate value-based purchasing. Washington has an agreement with the Centers for Medicare and Medicaid Services for a 5-year Medicaid transformation demonstration. This demonstration helps Washington continue changing the way it pays for and delivers Medicaid services throughout the state. The goal is that Washington's annual health care cost growth will be less than the national trend, and that nearly all health care payments are tied to quality and value, effectively purchasing more health for less. Payment is the key driver in how health care is delivered. The Healthcare Authority purchases care for over 2.2 million Washingtonians and manages more than $10 billion between employee health benefits and Apple Health, the state's Medicaid program, annually. As the largest purchaser of healthcare in Washington state, the HCA has committed to a value-based purchasing roadmap to transform the healthcare delivery system. The HCA is supporting providers in making the shift to delivering value-based care with resources like the Practice Transformation Support Hub, access to better data about their clients and their community, and regional collaboratives called Accountable Communities of Health. The HCA is helping providers apply a common set of best practices to treat patients, supporting the use of certified patient decision aids and tools to help people have conversations about their health, and meeting and tracking along common measures for quality care. Value-based purchasing rewards providers who control costs by focusing on better care. The result is lower healthcare costs. Paying for value means that patients receive the right amount of personalized care. Not too much, not too little. Personalized care helps prevent illness and manage complex health conditions, which means money can be spent in smarter ways for better outcomes. When providers coordinate with each other and prescribe the right amount of care, they're able to avoid extra costs from services the patient doesn't need. Through savings and avoided costs, VBP can save Washington State millions of dollars in the coming years. By aligning with the national movement and rewarding providers for improving patient health, value-based purchasing helps us achieve better care, healthier communities, and lower costs.
So I want to give a story of a courageous visionary CEO. I can't share her name publicly right now, or the organization's name, but it's a great story. In 2010, this health system CEO took the negotiations and the data to the payers, right? This is 2010, right? We're talking 6 years ago, before this was a popular thing to think about. She said to the dominant payer in her region, "We want fixed price contracts with quality measures, and we will save you money while improving care." The reality is where she's headed with those discussions is the eventual disintermediation of the dominant player. She's going to move towards direct contracting. In fact, she is doing that right now, where you're direct contracting with employers and disintermediating. She's taking on all the risk. But the first step was going towards these fixed price contracts with quality incentives with the dominant payer in a region. And oh, by the way, she said, don't invite your actuaries because we have better data. We know our costs, we know our outcomes way better than your actuaries do in this local community. She went to that negotiating table with the background of a costing system. She was one of the few in healthcare that had an actual costing system that was accurate to the patient level. The EHR was deployed everywhere. Very few gaps in clinically understanding a patient situation, and she was backed by a data warehouse that integrated clinical data, claims data, patient satisfaction data, supply chain, meds, labs, everything in one place. She was well equipped. 5 years prior to this, and it was before she actually took over, the healthcare board that governed this system started, and they knew that we were headed towards something like public health. So they engaged in public health campaigns. They took funding from cities and states in the community, partnered with churches, other social organizations, and they started their own public health campaigns. They added their own money into this. She assigned a permanent liaison to the law enforcement community to stop the revolving door of physicians to the ER, to the street, to the jail, rather from physicians, from the ER to the street, to the jail, and back again. She started a program in the primary and secondary schools to encourage early adoption of healthy lifestyles. They bought eye clinics. They bought dental clinics. They already had hospitals and medical clinics. They expanded their physical therapy. They bought into the long-term care and skilled nursing facilities. They expanded and purchased a retail pharmacy. And they moved to an employed doc model. And that all started 5 years prior. They have become, if you look at all those attributes, that's what we need to look like as a health management system of the future in the U.S. Those are the kinds of things you have to have all under one CEO, I believe. You might also add an insurance arm to this, which is where she's headed and where they are headed. Because now they have the data to manage risk more effectively than the traditional payer does. Next slide, Russ. So a couple of key notes here. When she engaged in those discussions with that payer, she realized it was more than a one-year commitment. It was going to take some time to do this. So she signed up to 2 3-year contracts and agreements. The first 3 years was essentially an experiment with the financials being kind of held in escrow in case something went wrong. Both parties agreed to that. And then if it went right, dispersing the money in an equal fashion and then going to full commitment in the second-year contract. They're now in the second of these 3-year contracts and agreements. She instituted a stop-loss insurance program in case they didn't quite understand the risk involved. And one of the key things that she did was expose costs to docs and patients at the point of care. That was an important part of making them feel like they were spending their own money, not someone else's. Next slide, please, Russ. So this is what it looks like. They're a Cerner-based system. They have a data warehouse with all the content I mentioned earlier. They built a cost application that hung off the edge of the data warehouse. It wasn't perfect, but it was better than having no data at all, and it's getting better all the time. And as I mentioned earlier, they were one of the they were blessed with the availability of what amounts to true costing data in the first place. They folded that back in a simple URL web page pass back to Cerner. You can do this tomorrow in your Cerner and Epic environments if you want to. And they also exposed it outside the clinical encounter through a web page, so that docs and staff could look up costs of care no matter what. It's a cost estimator application. It's actually a very easy thing to do technically. Of course, the data warehouse is a little bit of a challenge. The rest of it is quite easy. Okay, next slide, Russ. So one of the things that she also did was simplify the compensation models for her physicians. So we have all witnessed these complex allocation models have been a total failure wherever they're, I mean, they're just, not only are they a failure in that they create animosity, they're full of ambiguity, but the administrative overhead of managing really complex allocation models just adds to the all.
All right. Okay. Looks like our sound just cut out. We will be sending out all of these slides. The links to the video. I think you only missed about 2 minutes of the very end of that one. So we're going to go ahead and switch over to the part 2 of this. My name is Nicole Willis, and I've got Amanda here. And we're going to go over fairly quickly the value-based payment survey that several of you should have got an email about recently. And we're just going to go through it and talk about some additional resources about VBP that the Healthcare Authority has on a website for you. So next slide. So the Washington State Healthcare Authority's 2019 Paying for Value Provider Survey is now up and running. It opened on July 1st. Partners have until 5 p.m. on August 30th to complete the survey. As I mentioned, I think it was July 5th, reminder surveys were sent out from our staff here at Sound ACH for all organizations that had committed to, it's under the capacity building milestone 5 in the change plan to examine and report barriers of successful adoption of value-based purchasing. And so in that, we are encouraging and requiring partners who've committed to that to complete the VBP survey. In the email, there should have been a direct link to the survey, and I'm going to post that right now in the chat box. Should be 2 in there. There's one directly to the resource, to the survey, and then another to the resource website that I'll get to in a moment. This year, good news, it's not an Excel spreadsheet like it has been in the past. It's an actual survey, so it's a smidge easier to complete from what we've heard from partners who've already completed it. Just for like FYI, the VBP survey is designed to better understand partner needs and inform the Healthcare Authority delivery system transformation efforts. The survey includes 5 sections. There's provider information, participation in VBP, experience with VBP, health disparities and health equity and integration, workforce, and technical support. The financial questions included in the second session are in reference to the 2018 calendar. And the Healthcare Authority has provided some guidance on who would be a target of completing the survey. And their recommendation is that it can be and should be completed by an administrative leader with consultation where needed from staff as everyone sees fit. We're hearing it should take about 30 to 45 minutes to complete. We also have available a PDF version of the survey, and we are happy to send that out to anyone if that helps complete the survey in a more timely manner. I know that can be a little helpful to do it ahead of time. Okay, next slide.
This is the website online. So when you follow that link, this is what it will look like. And it will highlight one question at a time. And you can just go through it and answer these questions. And there's a couple pages of questions. So you can go through that when you are ready to. And then we'll go back to share.
Okay. And so, as I mentioned, completion of the VBP is part of requirements for certain partners who've committed to that strategy in their change plan. And we're counting the completion of the VBP survey with the next round of partner reporting. The reporting portion won't be due until October 31st, but we're including the VBP survey because it's come after the first round of reporting, which was done in April. So in an effort to try to streamline ease of reporting if you've completed the survey, we actually found a really helpful option embedded in the survey itself that should save some time in reporting. So in question 38 of the survey, which is I think the second to last question, it asks if organizations would give the healthcare authority permission to share their responses to the North Sound ACH. If you select yes to question 8, we'll know that you've completed the survey and it'll allow the healthcare authority to share your responses with us. We will not share any individual organization responses outside, and any analysis that we intend to do will be completed at a regional level with the ultimate hope to start comparing like a comparative analysis of how we're doing in our region around VBP to other ACH regions. So we can kind of start understanding the story and the barriers that are occurring and the successes that are happening. Next slide. So we wanted to take a moment to share the value-based payment resources website that I mentioned that Healthcare Authority has. The first video we showed is actually right on this website, and it is the second link that I've provided in the chat box. So what's really helpful, there's a lot of resources. This video very helpful, I think, for folks who are either new to VBP or are hoping to educate their staff a bit more about VBP. If you scroll down the page, you can start to identify the healthcare authority's approach to increasing value-based payment throughout the state. There's a lot of information on this website, so I encourage folks to kind of explore. As you keep scrolling down, there's another way to get into the value-based payment survey. And if you want to hover over the paying for value, just an FYI, if you click on the first one, that's going to take you to paying for value. And that one's for not for partners, that's for payers. And it'll take you to a link that you won't want to, it's much more complicated, and don't click on that one. And the next one is the one that you want to click on, and that'll take you directly to the survey itself. And if you're curious, there's a report here on the 2018 survey results. And then there's, as you keep scrolling down, more information about kind of the overall framework and roadmap of where the state is envisioning heading around value-based payment. We're going to mention a few of these the contacts at the end, but the three staff here are great in answering questions around general questions around VBP. And then JD Fisher is the main contact for the survey itself. So if you're having challenges with the survey or the tool, that would be your person to contact. Okay. So this is a shorter webinar, and Amanda and I are available to respond to some questions now. I'll just throw out the disclaimer that a lot of the effort, especially around the survey, is healthcare authority driven. So we are happy to collect questions, and we might not have the answer if they're specifically around some of the healthcare authorities' approach to things, but we are more than happy to elevate any of those questions to the context that we showed the previous slide. So we'll just give a few minutes if anyone has any questions, and we can answer those. Okay, so you're still completely able to submit questions to us directly at our team at northsoundach.org. And then, as I mentioned before, if you have specific questions about the survey, then JD Fisher would be the correct contact for you at the Healthcare Authority. Looks like there is one question, great question. Are these surveys only for healthcare providers or everyone in North Sound ACH? The VBP value-based survey is really focused on clinical providers, and there was a question or a strategy in the change plan where we were able to identify which partners would be required to take that. So if your organization has not committed to that strategy, then you do not have to complete the survey. And it also, if you're not an organization with current value-based contracts, then that's also an indicator that you do not have to take the survey. So if that helps. And I think with that, if there are no other questions, just a reminder that you can email us. We have some upcoming webinars on July 17th, the 24th, and 31st. And we want to thank you for joining us today, and have a great rest of your week.